Hi, my name is Kate Rowe, and my topic of speech is understanding medical marijuana. While countless people have different perspectives over the popular debated topic of medical marijuana, there are many beneficial aspects to using this plant for medical purposes. As awareness for the medical aids of marijuana rise, more and more states are beginning to legalize and allow its use. Various people feel the only medical significance of marijuana is pain relief. However, this is an inaccurate rumor. Due to research, there are many other beneficial aspects being discovered about the plant. The use of medical marijuana dates back decades from today. Cannabis was included in the American Pharmacopoeia until 1942. The American Pharmacopoeia is an official publication consisting of lists of drugs along with their effects and the directions for use. In the 1990s, the word of use of marijuana for medical purposes spread and became very popular. In 1990, the IOM, or Institute of Medicine, determined that cannabis was a safe and effective drug. The IOM indicated that patients should have access to the drug, and the government should expand opportunities for research and development of the drug. Researchers continue to study marijuana's medical value to this day, and so far the findings are outstanding. There are two chemicals in marijuana that researchers believe to have medicinal value. Cannabidiol and tetracannabidiol chemicals both have been proven to provide pain relief. There are abundant amounts of research and studies that recognize the fact that cannabidiols help lessen pain and affect a wide variety of systems and bodily functions. So other drugs or chemicals in medical marijuana are B-caryophyllene, which is used to reduce inflammation, and cannabigerol, which relieves intraocular pressure in the eye and is used to treat glaucoma. Cancer, HIV and AIDS, and multiple sclerosis are the most common disorders for which marijuana is permitted as a treatment in the United States. However, there is evidence that marijuana relieves nausea, improves appetite, and eases spasms in patients with these disorders. Side effects of marijuana typically do not last for long periods of time, but include drowsiness, dizziness, short-term memory loss, and euphoria. Few users develop dependence, and those that do, dependence is mild and often is short-termed. Due to the fact that marijuana is still illegal for other uses that aren't medical, and pharmacies are forbidden from providing or selling it, understanding how patients prescribed or recommended medical marijuana and receive it can be perplexing. A doctor's recommendation or prescription remains effective as long as the doctor continues to treat the patient and believes the patient will still benefit from the use of the drug. Patients receive an ID card and then are allowed to purchase medical marijuana from stores that are called dispensaries. At dispensaries, patients can purchase different forms of herbal medical marijuana and different types of medical marijuana-based products and prepared foods. Up on my poster, I have an example of an ID card of a patient who was prescribed medical marijuana. And I also have medical cannabis refers to the use of marijuana as a physician-prescribed therapy to reduce the pain or discomfort associated with some medical conditions, or to lessen the side effects of some traditional medical treatments. The evidence from research supports that there are in fact benefits associated with using marijuana medically. Many people are now exploiting the use of medical marijuana, making it a reasonable substitute for modern treatments and medicines. Studies have shown that marijuana is now an addictive substance, and it is becoming legal in many states throughout the United States, as well as many other countries around the world. On my poster, I have a map of the United States, and it shows states that have legalized medical marijuana's use. Some examples are Alaska, Montana, Colorado, Arizona, California, Oregon, and Washington. We can only predict that the legalization of marijuana for medical purposes will rise. With the constantly changing viewpoints and policies on legalization of medical marijuana, and its giant leap forward in legalization in the United States, we can assume that in the next decade, close to all 50 states will legalize its use.